So today we're going to be talking about vertebrobasilar presentations to neuro-ophthalmology, and it can be either the vertebral system or the basilar system. As you know, the vertebral arteries arise and run in the vertebrae. That's why they're called the vertebrals. They're in that vertebral foramen, and then they meet as a basilar artery and then terminate as the posterior cerebral arteries. So we have to worry about both the direct effects as well as the downstream effects of vertebral or basilar disease. And of course then that forms the rest of the circle of Willis. So today we're going to be talking about only the posterior circulation here. So in a young person, the thing that we're worried about is a dissection, a tear with a false lumen, the vertebral dissection. And so that usually presents to us as downstream thromboembolic disease. So when we have vertebral dissection, either from trauma or sometimes from no cause, the tear can form thrombus, and then the thrombus can fly up. And normally these are extracranial dissections, they're in the neck. And then the vertebral dissection can be on the right side, and you can have symptoms on both sides or either side, because once it gets into the basilar, it can go to either side. So even though the lesion is on the right, the problem might actually be on the left. And so because we have different branches from the basilar artery, including basilar perforators into the brainstem, that means we can have both efferent presentations, double vision, third nerve palsies, cranial neuropathies of various types, and afferent complaints, which are going to be either a homonymous hemianopsia, if it goes into the PCA, be a contralateral homonymous hemianopsia, or if it is in both, they might get bilateral simultaneous loss of vision that can manifest at various degrees of severity, count fingers, hand motion, no light perception even. So in an older person, it's usually vertebrobasilar disease from the usual suspects, atherosclerotic disease, then thromboembolic disease from small vessel ischemic disease. But large vessel disease can also occur in the vertebrobasilar system and cause strokes. For example, you might get a pica infarct from a vert dissection, and that's going to be the Wallenberg. The pica is the posterior inferior cerebellar artery that might present to us as nystagmus or Horner syndrome. And so when you're thinking about vertebrobasilar disease, you can think about it as thromboembolic disease, artery-to-artery embolus. If you're a young person in that setting, we're thinking about dissection. If you're an older person, you still have to think about dissection, but we're more concerned with the usual suspects. And it could be more proximal disease from the heart, so it just went into the vertebrobasilar system, but it came from the heart. So cardiogenic etiologies, atrial fibrillation, all still at play. And you should know it can present with diplopia, nystagmus on the efferent side, and on the afferent side, because the posterior cerebral artery is the terminal artery for this basilar artery, we can get a homonymous hemianopsia in the occipital lobe, or bilateral juxtaposed homonymous hemianopsias and cortical visual loss from vertebrobasilar disease.